Hey, I'd like. My name is Calvert Tisdale, and I'm a postdoctoral research fellow at NDA called the National Drug and Alcohol Research Centre, and I'll be chairing this amazing webinar today. I'd just like to give a warm welcome to everyone joining us in the audience today. That includes many varied perspectives from various stakeholders, people with lived and living experiences, researchers, members of community, health professionals, and I'm sure I've missed other roles and valued perspectives too. Before we start with the webinar, I would just like to begin by acknowledging the Bidjigal and Gadigal people from where I am joining this meeting today, who are the traditional custodians. I'd also like to acknowledge the traditional owners of country throughout Australia, noting that our speakers from Queensland and audience are joining from many different locations across Australia. And I'd like to pay my respects to the elders past, present, and also extend that respect to any First Nations people present today and any future leaders as well. Today, I have the pleasure of introducing Dr. Ara Cho. Dr. Ara Cho is a postdoctoral research fellow at the School of Public Health at the University of Queensland, and I even had the pleasure of doing my PhD alongside Ara for a little bit as well at the University of Queensland. Her research has a focus on the impact of tobacco tax increases on smoking and tobacco purchasing behaviours, and currently her research focuses on the unintended consequences of the tobacco tax increase, which includes illicit tobacco use and the financial hardship among those individuals who smoke. So we're very lucky today to have Dr. Ara present her work on the correlates of smoking-induced deprivation and its impact on smoking cessation. Following Ara's presentation, we will be joined for the panel discussion by Professor Coral Gardner. Coral is an international expert in tobacco control policy and the world's leading expert on electronic nicotine delivery systems, also known as e-cigarettes. She's the director of the NHMRC Centre of Excellence, Research Excellence on Achieving the Tobacco Endgame, and leads a multidisciplinary research team of international experts all over the world to develop the evidence base for tobacco endgame strategies and to identify the most promising policies that could end the cigarette epidemic in Australia and beyond. We're going to have time for questions at the end, so please do send them through during the presentation, after the presentation, during the discussion, at any point, and I will try and feed them through to Ara and Coral to get their perspective. Please use the Q&A function and not the chat function, and I will do my best to ask as many questions as possible. But for now, I'm going to hand over to Ara and invite her to please turn on her camera and take it away, Ara.
Thank you so much, Calvert, for your kind introduction. Sorry. To rearrange. Yeah, so thank you, Calvert, again for kindly introducing myself, and good afternoon, everyone. And thanks so much for this opportunity to speak with you today. So today, my work focuses on the intersection of tobacco use and economic hardship, what we refer to as smoking-induced deprivation. Before I begin, I also acknowledge the traditional custodians and owners of this land, especially the Jagera people and Turrbal people here in Brisbane. And I pay my respects to elders past, present, and emerging. It is well established that individuals from low socioeconomic status group have higher smoking rates compared to the general population. The 2017 systematic review and meta-analysis found a very clear pattern showing that smoking rates are higher amongst individuals on lower incomes. In other words, the lower the income, the higher the prevalence of smoking across all countries and population subgroups. But this is not just about the prevalence. Tobacco use actively deepens social and economic inequalities. It also contributes to a cycle of intergenerational poverty, particularly when individuals under financial stress continue to spend more money cigarettes, despite facing other essential expenses. They've now been also recognized as a form of social injustice in the most recent US Surgeon General report. Then how about in Australia? Australia has made significant efforts to reduce smoking prevalence over the years. And while smoking rates have declined overall to 10.6% here in, like you see the green bar here, recent data show that significant inequalities still persist. For example, if you look at the pink bar here, you will see that individuals living in the most disadvantageous areas are much more likely to smoke daily than those in the least disadvantageous areas, 18.1% versus just 5.4%. Similarly, the red bar here shows that people who are unemployed are more than twice as likely to be daily cigarette consumers compared to those who are employed, 24% versus only 10%. Smoking places a significant financial burden on people who smoke cigarettes. Compared to high income groups, those on lower incomes spend a much greater share of their household budget on tobacco. This often comes at the expenses of other goods and services like food, healthcare, insurance, transportation, entertainment, as well as education. And in some groups, they spend more on alcohol as well. Here in Australia, the financial burden is made even heavier by the high cost of cigarettes. Cigarettes in Australia are among the most expensive in the world. This 2022 news headline highlights the points very well. A single pack of cigarettes can cost about the same as a basic grocery shop. So why are cigarettes so expensive in Australia? This price increase are largely driven by the tobacco tax increases over the last 20 years. Back in April 2010, the government introduced a 25% increase in tobacco excise. And then from 2013 to 2020, excise was increased by 12.5% annually. More recently, in September 2023, a new policy was introduced to raise tobacco tax excise by 5% every year for the next 3 years. This graph also shows the price of the most sold cigarette brand in 4 countries, including Australia, the United Kingdom, Canada, and the United States from 2016 to 2022. Australia had the highest price by far, and the price went from $15 in 2016 to $23 in 2022. And the UK and Canada also saw some increases, but not as sharp. And the US had the lowest price, increasing slowly to around $8. More recently, the COVID-19 pandemic, followed by the ongoing cost of living crisis, has placed even greater financial pressure on people, particularly those already experiencing disadvantage. In Australia, the cost of living rose sharply during the pandemic and has remained high ever since. One very striking example comes from recent Food Bank's 2023 hunger report, which found that 2/3 of Australians facing food insecurity were experiencing it for the first time. So in the context of rising prices train, how exactly the financial stress related with smoking behavior? Previous study found that people who smoke were more likely to experience financial stress than those who never smoke or have quit. Other international research also found that individuals with low incomes or higher nicotine dependence who are much more likely to experience smoking-induced deprivation, where spending on cigarettes take priority over essentials like food. In the 2009 study found financial stress can significantly hinder quit attempts. However, there are still limited evidence on how smoking-induced deprivation affects the quitting-related behaviors as highlighted in the earliest study in 2007. So it is very worth noting that many of these studies were actually conducted before the most recent tobacco tax increases and before the cost of living crisis intensified. Given the financial pressures people now face, not just in Australia, but also in countries like the US, Canada, and the UK, there is a clear need for updated cross-country research that reflects this new economic environment, particularly for those experiencing disadvantage. So our research set out to address this gap. Specifically, we aim to estimate trend in smoking-induced deprivation between 2016 and 2022 across 4 countries. And we also examined the demographic, health, and smoking-related characteristics associated with experienced deprivation, and more importantly, how this experience affects quit attempts or successful quitting. For this study, we used data from 4 waves of the International Tobacco Control 4 country smoking and vaping surveys conducted between 2016 and 2022. The survey was carried out in Canada, England, and the United States and Australia, and recruited a nationally representative sample of individuals who smoke in each country. Our study sample included adults who had smoked at least 100 cigarettes in their lifetime and reported smoking at least monthly. In total, we analyzed data from around 24,000 participants across the 4 countries. In addition to the 4th sample, we also identified a subsample of participants who smoked at least monthly at time t and completed at least 1-way follow-up survey at time t+1. This group, around 7,000 participants, was used to examine the association between deprivation and quitting-related behaviors. We defined the smoking-induced deprivation based on whether participants responded that in the past 6 months, their spending on cigarettes have left them without enough money for household essentials, things like food. And for the longitudinal analysis, we also looked at 2 key outcomes related to quitting. First, we looked at whether someone had made at least 1 quit attempt since their last survey. And second, we also defined the successful quitting as those who tried to quit and reported that they were no longer smoking by the next follow-up. In our analysis, we included a range of covariates to help us understand who is most at risk of experiencing this deprivation. And this includes socioeconomic factors such as country of residence, age, sex at birth, ethnicity, education, and income. We also included smoking and health-related factors like smoking intensity, vaping status, illicit tobacco purchase in last 6 months, intention to quit, self-efficacy to quit, and perceived stress. We ran two main sets of the analysis. First, we looked at which factors are associated with a higher likelihood of experiencing deprivation. And these results are based on cross-sectional data, and we use a method called generalized estimating equations, or GEEs, to take into account that many participants completed more than one wave of the survey. We also tested whether the association between deprivation differed by country or by income level. And then second, we looked at whether experiencing deprivation at one point in time made people more or less likely to try quitting and successfully quit by the next wave. For this one, we again use GEEs, this time applying longitudinal weights for each country. So what did we find? We found that across all 4 countries, the proportion of people experiencing smoking-induced deprivation increased significantly from 9.5% in 2016 to 14.6% in 2022. In 2022, Australia had the highest rate, with nearly 23% of Australians who smoke reporting deprivation. In contrast, the United States had the lowest at just under 10%. We also looked at how different socioeconomic factors were associated with experiencing smoking-induced deprivation. We found that younger adults, men, and those with lower household incomes were more likely to report these experiences. We also looked at smoking-related factors associated with this deprivation. People smoke at medium or high intensity, those who were currently vaping, and those who have had used illicit tobacco in the past 6 months were all more likely to report deprivation. We also saw this pattern among people who were intending to quit in the next 6 months, had higher levels of perceived stress, or had lower confidence in their ability to quit. And then we looked at smoking cessation behaviors. We found that overall about 44% of participants made a quit attempt. But there was a clear difference between those who had experienced deprivation and those who hadn't. Even after adjusting for key covariates, experiencing deprivation was significantly associated with a higher likelihood of making a quit attempt at the one-way follow-up. Among those who made at least one quit attempt, we looked at whether experiencing deprivation affect their changes of smoking, quitting successfully. What we found was quite striking. Individuals who had experienced deprivation were less likely to successfully quit smoking at one wave of follow-up. So while deprivation may motivate a quit attempt, it may also make it harder to follow though. To summarize, we found that smoking-induced deprivation has been increasing, especially in countries where cigarettes are more expensive, like England and Australia. And more people are prioritizing cigarettes over essentials. And this was particularly common among those who were socioeconomically disadvantaged and had higher smoking intensity, experienced more stress, or lack confidence in their ability to quit. We also found that deprivation was significantly associated with making a quit attempt, which might suggest that financial pressure can be a motivator. But at the same time, those experiencing deprivation were less likely to quit successfully. And finally, while some were motivated to quit, others turned to cheaper alternatives such as illicit tobacco. So these findings highlight several important implications for strengthening current cessation support, particularly for disadvantaged groups. There is a systematic review and meta-analysis published in 2019, and the authors found that individual level cessation interventions were more effective among people from disadvantaged background. But to really support these groups, other recent reviews suggest multi-component interventions. Reviews have highlighted several key features of effective programs, things like social support, community involvement to tailor strategies, and the use of combination pharmacotherapies like varenicline and nicotine replacement therapy, and financial incentives. And then in addition to these previous findings, interventions that build resilience, strengthen motivation and self-efficacy, and address life stressors have shown promise as well. And offering more flexible options for nicotine replacement therapy, including sampling different types, can help people stick with treatment and improve quit outcomes. Especially in Australia, previous research found that GP and other healthcare providers are very known and trusted sources of cessation information and advice, especially for disadvantaged group who smoke, and lower SES individuals who smoke were just as likely as other socioeconomic groups to report being advised to quit by their doctor. So integrating cessation interventions into routine care could play an important role in reducing smoking among disadvantaged population. At the population level, tobacco tax increases and mass media campaigns, especially for the strong narratives, has been effective in reducing smoking. So there is evidence about the impacts of a tobacco tax increase on smoking prevalence in Australia. And this graph from a time series analysis from data from cross-sectional surveys, and they found that there was an immediate reduction in the prevalence of smoking and e-cigarettes following the 25% tax increases in Australia. And there were also the increase in prevalence of smoking roll-on cigarettes. And the overall smoking prevalence actually decreased further during the series of 12.5% annual tax increases from 2013 to 2017. Our previous research also found that the main motivation cited for changing smoking behavior actually switched from health-related from 2007 to 2010 to cost-related from 2013 to 2019. So in Australia, in 2019, more than half of past-year cigarette users reported that they changed their smoking behavior because smoking is too expensive. But more recently, there has been growing concern about the unintended consequences of tobacco tax increases, particularly for people already experiencing financial hardship. So while taxation remains one of the cost-effective tobacco control measures, it is really crucial that it's balanced with accessible and well-supported cessation strategies. So in Australian context, this means that pairing the tobacco tax policies with strong and targeted quit support to ensure that people aren't just paying more, but they are also being genuinely supported to quit. This study also supports the Australian government's current commitment to smoking and vaping prevalence and reduction measures. It was announced in May 2023, and the budget measures include national public health campaigns to discourage people from smoking and vaping, and increase and enhance smoking and vaping cessation support, as well as a further annual 5% tax increases for the next 3 years. And just 1 month ago, the government also announced around 156 million investment to crack down the illicit tobacco, strengthen law enforcement, and support public health. And just 2 days ago, the new Public Health Act came into effect. So with so many new policies and investment rolling out this year, so we are hopeful these changes will lead to meaningful improvements in public health. And like any other studies, our has also a few limitations to consider. First, our data, the data we use are self-reported, which may be subject to recall or reporting bias. And while we had relatively high attrition across rates between 38 and 48%, so I conducted an additional analysis to compare participants in one wave, but not in the next wave, and those who participated in 2 consecutive waves between the first and fourth waves, while several analytic variables showed significant changes, but the effect size we observed were generally small. And this study also has several strengths. It draws on a large and longitudinal data set that spans 4 countries and includes nationally representative samples of people who smoke. So our findings have a good cross-country generalizability. Finally, I'd like to sincerely thank Professor Cole Gardner and my co-authors for their support and valuable feedback throughout this research. I also want to extend special thanks to our Tobacco and Games theory team. It's been such a privilege to be part of such a dedicated and inspiring group. Thank you so much for your attention. I am more than happy to take any questions.
Amazing. Thank you so much, Ara, for that wonderful presentation. You've introduced a myriad of important considerations when thinking about tobacco taxation. Thank you so much, Coral. I see you've turned on your camera as well. Thank you for joining us today. Before I invite you to make your comments on the wonderful presentation we've just seen, I just want to do a quick reminder to please put any of your questions into the Q&A function. I can already see there are a number of thoughtful questions on there that we can address in a moment. But for now, I will pass over to Coral to give your immediate reflections on Ara's presentation.
Thanks so much, Calvert, and thanks, Ara, for such a great presentation of this really interesting research that you've done that's highly topical at the moment. So I guess I'll just run through like a few sort of standout points that came out to me from the presentation. One of the things, when we're looking at the price, you put up the price of the amount of tax that's gone up over time in Australia, and then we've also seen the price in the next slide of the most sold cigarette brand according to World Health Organization. And I thought there are a couple of interesting things that came out to me from just looking at those 2 different graphs. So firstly, Australia's got quite expensive cigarettes compared to the other countries, but where the Australian government is actually just setting the tobacco tax at what is the recommended level. So the World Health Organization suggests that the level of tobacco taxes should make up at least 70% of the retail price. So when we look at the price of the cigarettes and the tax, it actually is sitting at that for most products, and even some products aren't at that 70% level. So I thought that was just an interesting thing, that maybe it's suggesting that the other countries are a bit behind in their tax rather than, that we're taxing at a much higher rate, that we're actually doing what's recommended from the best practice point of view. The other thing that I thought was interesting is when we look at the slide on the World Health Organization reporting on the price of a pack of 20 cigarettes and the most sold brand, the amount actually didn't change that much between 2016 and if anything, it went down between 2016 and 2018. So I think that was about slide 8. And that was despite there being an annual tobacco tax increase at that time in Australia, which is quite interesting then, that the price wasn't going up every year during that time period, even though the tax amount was going up by 12.5% each year. And then we saw again that there was this increase in the price between 2020 and 2022. But that was during a time when the taxes weren't going up. So that was at a period when the only increase was from the biannual inflation adjustment. So it just seems to me that there may be other factors as well that are involved in setting the price of tobacco product pricing other than just the tobacco tax, that industry pricing also plays a role here. And I think that's also an important issue that, Ara, that you have looked at previously too. Also, touching on the issue of smoking-induced deprivation. So, we saw that increase substantially between 2020 and 2022 in all the countries that you examined. And I suspect that, as you alluded to in the introduction, that, the increased cost of living that occurred during that COVID pandemic response is a critical factor here. That, again, there wasn't actually increases in the amount of tobacco tax in Australia between 2020 and 2022, and yet we saw the increase in that smoking-induced deprivation there. So obviously there are those other broader societal factors too that are contributing to this issue. We also saw from the analysis that, there are specific characteristics of people that are more likely to experience this issue of smoking-induced deprivation. So, younger people, as well as people who were smoking at a higher level and people with lower quitting self-efficacy. And so that also highlighted to me that, the issue between who are those people that maybe need that greater support, and are those people being reached by our current approaches to smoking cessation in Australia. Also thinking about the relationship that you found between experiencing smoking-induced deprivation and purchasing illicitly traded tobacco products. So again, highly topical, and for me also highlights the need for us to understand why people are being drawn to purchasing those products and what we can maybe do that may discourage those people and get them into doing something like quitting smoking, trying some nicotine replacement therapy and so on. So I think that was also another message for me. But of course, the major take-home message was that people experiencing smoking-induced deprivation were more likely to want to quit smoking than other people, but they were less successful when they tried to do so. So again, raising those issues about whether these people are being reached with the current supports that are available, whether they're being given enough support, and whether there are things that we can do, such as improving their access to a wider range of smoking cessation treatments. For example, PBS subsidisation of nicotine replacement therapy doesn't include patch plus nicotine gum or lozenge, like that combination therapy. It's just covering patches at the moment. But we saw that the people who are experiencing this were more likely to smoke at a higher level, smoke more cigarettes per day. So they would be the people who need that combination therapy to address the higher level of nicotine dependence. So whether the current level of subsidisation of smoking cessation treatment is actually at the right level if we're to help these people. So again, that was a take-home message for me. So I'm happy to hand over to Calvert and Ara for addressing the questions now.
Yeah, thank you so much for that fantastic summary. I must say you touched on a lot of my own thoughts, so you've cut a lot of my own questions away, which is great because I was thinking of the same things. We might just quickly visit the Q&A to get some of these questions out. So the first one that I saw during your presentation was actually something that I myself was thinking a bit differently, but thinking about the impact of smoking on financial related factors was what you were talking about. And I couldn't help but think of contingency management as a possible option of treatment for this population. And it's seen varying effects across different substance use types. And I understand it may not be your area, but I'm wondering if you know of the research for contingency management or essentially a monetary or financial incentive for treatment or cessation of smoking.
Sure. I think it's obviously it's bit. I have bit lack of the smoking cessation options for this group, but what I understanding for the cessation support for the especially for the disadvantaged population, it really depends on the state policy. But here in Queensland, they can approach to the quitline service, and then they also offer 12 months free cessation support program. So they can actually also offer free nicotine replacement therapy, and then and other counseling support as well. But I think there is also issue that it's not actually consistent across states as well. So people might not know about this. If they don't know about this this support, then it's really hard to access to this available smoking cessation program as well. So yeah, here in Queensland we have more support than other states.
Would you like me to jump in just on the contingency management issue? So that's that program that it's been trialled in the UK, I believe, amongst pregnant people who smoke, where they receive a payment when they stop smoking. So yeah, it's a really interesting intervention, and I think there's been some, some really promising outcomes from some of those from that intervention that's been trialled in different populations. There's also been trialled in other substance use disorders as well. So, I guess for me, I can't help thinking that why maybe the evidence base on that and why it hasn't been rolled out more broadly is some of the stigma associated with addiction and the difficulty that it may be in terms of getting that policy up around the idea of paying people to stop smoking. So I think, certainly amongst pregnant people, that's probably where the policy has the most public support. So that might be why the focus has been on there. But also, even if, if that program was to get up and offered to people, it would need to also make sure that there was really good quit support for those people obviously accessing that. And you still have that issue of it's not going to be 100% effective for everyone. So we also have to keep that in mind too, that, that quit support is absolutely essential, and making sure that people have all the best support that's available with pharmacotherapy and with also these behavioural support measures as well.
Yeah, thank you so much both for addressing that. It is a very also it's an ethical minefield as well to consider. You were speaking about people who were smoking while pregnant. I'm just going to piggyback off that to answer Anusha's question around the impact of marital status and living with children, and the impacts on expenditure that this might have with this support quit attempts, for example.
So I think the families with kids will have more like a heavier financial press, obviously. And then that's why I actually put the more social support to help this population as well, because I don't think just the public health support such as more cessation support isn't working alone. So we need more like multi-component and comprehensive approach for this population, I think. And one of the things could be the like more support for the families as well. Or, yeah.
Yeah. And did you want to add anything to that, Coral?
Oh, no, I think, there's a lot of different programs that we could look at to engage different population groups. So particularly those family support, so looking at the other stress factors in people's lives that may be making them feel like they have less control over their life and less ability to quit smoking. I think, a range of social supports, including, parental, parenting programs and so on as well. Increasing access to those sorts of things as well can also help people in terms of reducing their stress.
Yeah. And I think this question from Renee regarding the continuation of nicotine use despite best interest, and how this is often not siloed to only one issue, and it's often grouped with other co-occurring concerns such as mental health or other substance use disorders. And obviously these financial stresses, social factors. So I think it's important to note that, the gold standard would be if we could tailor interventions to these situations. And that would be probably the perfect world situation, I'm guessing. But it's about coming up with compromises with what is feasible. One question that I'm sure comes up in all of these presentations is around vaping. The legalization of vaping, James Durl has commented around the legalization in 2024 and how much research there has been on switching behavior beyond anecdotal.
Yeah, I think this is a really important issue in vaping. And actually, in previous research, I looked at the impact of tobacco tax increase on smoking, minimizing cost minimizing behaviors. Sorry, and one of the cost minimizing behavior we included was vaping in Australia, because the cost of vaping is usually it depends on the type of product, but usually cheaper in other countries because the traditional cigarette price isn't that high. But here in Australia, the previous research found that the cost of smoking in Australia is actually more expensive than vaping. So we actually thought that vaping could be a smoking cost minimizing behavior to reduce their financial burden among individuals who smoke. And what we found is that we actually found non-significant association using vaping as a cost minimizing behavior. But what we actually did find is that individuals who smoke and use vape at the same time, they reported the reason to vape was because of cost of smoking. So I think they are very price sensitive group. So they try to keep trying to seek the economic alternatives. So it includes vaping as well, I think.
And in terms of evaluation of the current policy, so that change to allowing nicotine vaping products to be sold by in pharmacies and the pathways, the different pathways to that. So we do have data that's been collected that started being collected in October after that change in the last change that happened. And we've got that data now, but we're just waiting on the weighting to be finished. So we'll hopefully have some good data in terms of who's accessing nicotine vaping products through that pathway, who's accessing it through the illegal market, and also smoking cessation outcomes associated with that. So hopefully we'll have something soon, maybe later this year, to share on that topic.
Yes, and I'm sure many people will be very interested in that. I definitely am, because it all happened very suddenly. And I guess coming off of the illegal market, well, still staying in that realm, you mentioned in your reflections, Coral, the illegal tobacco market, and that has seen a rise more recently as well, presumably because of relation to finance, and as it being a much cheaper option with potentially clean-skinned packaging as well, with varying impacts. I wonder if you could comment on your thoughts on how that might play into the financial stress side of
Yeah.
smoking behavior.
Oh, did Ara want to answer that, or sorry, I just feel like I've just
I'm
taken.
happy for either. Perhaps Ara, you could give us your
Yeah.
reflections first, and then Coral could jump in after.
Yes. So recently there are growing concern about illicit tobacco, and illicit tobacco trade actually increased in Australia. There are a lot of debate on whether we should decrease tobacco tax or to combat illicit tobacco as well. So illicit tobacco is a really genuine concern. And it's really cheaper alternative option for individuals who smoked. But it are really aware about it shouldn't just by rolling back public health policies, because instead we can actually enhance more like enforcement to combat illicit tobacco trade, or we can actually invest more money in technologies to detect or like disrupt this trade, just like as the current government actually just announced it. So I think it's really about tackling the supply chain rather than people making more opportunity to individuals who smoke to take illicit tobacco as a cheap option. So yeah, hopefully it.
And I think also, if we think about like most people who smoke, like a large proportion of them actually don't really want to keep smoking. It's because they're having trouble quitting, and the current prices are also making it a little bit higher price. So people want to quit smoking for many reasons, and you know, health is one of those ones that is a major reason why people want to quit smoking. But the higher prices also bring it a little bit more closer to, you know, temporally to yourself, to making action now. So the higher prices are very important in terms of also driving people and younger people too, who may be thinking, oh, they've got many years ahead before they're going to experience health issues, to take action on smoking. But also, you know, if we think about like that, most people want to quit smoking. So one of the major interventions we should be doing for tackling illicit trade is also helping people to do another option, which is to quit smoking. So it's also that reducing the demand for the illicit products. I'd also point out that it is an international issue. So the illicit trade has also increased internationally. It's not just an Australian phenomenon. And so this is where that international cooperation is really important through international agreements, through like say the Framework Convention on Tobacco Control and so on, and starting to tackle the problem offshore before it reaches us, as well as onshore. There's also been like a lot of interventions that are starting to roll out now, like, you know, tobacco licensing and so on, and getting more control over that domestic supply chain through also at the retailer level, which there hasn't been a lot of action on previously. It's been a bit of a like loophole there. So there's a few things that are happening at that retailer space too, which is really important to tackling this issue.
Yeah, thank you so much both. And I think it's a really important point to highlight the global context and not just the Australian context, but because I think it sometimes gets lost in how topical it is among general population and researchers, that the Australian context is the only place it's happening. One question from an anonymous attendee that I think is important to note is, are you doing any research within communities of Indigenous people or other ethnic backgrounds?
So I guess, yeah, actually our is involved in this. We're doing a systematic review at the moment of looking at what research is happening in Australia so that we can identify also where there are gaps and where we need more research activity in the culturally and linguistically diverse community space. So understanding what we know and what we don't know about tobacco cessation and so on amongst these populations in Australia. So that's one, I guess, one paper that's in the process. If you're talking about what publications that we have coming up, we haven't got currently amongst this data set an analysis planned that's First Nations specific. But there is some other research that's more broadly associated with the Centre of Research Excellence based at University of Melbourne with some modelling and so on that will have that component as part as well.
And I'm sure when you're looking at something as broad as smoking and as broad as financial stress in the time it is now, it is a bit of a wide net. So I appreciate that you can pull that out of your brain. So one question we have here from Janelle is looking at the methods that people use to support their quit attempts, and were the people with higher deprivation who are making more quit attempts less likely to use pharmacotherapy, or were they less likely to seek support, such as through a GP? And would that be related to why they were less successful in their quits attempts?
Yeah, so this part is actually one of the part we are planning to do as part of this analysis. We are going to look at the whether there is any differences by using different cessation support program by the groups who experience deprivation or who haven't. So hopefully we can actually find the differences among these groups, and then can actually suggest like more cessation support for this group. So yeah, it's actually now in progress right now.
Fantastic. I might end the session on this question because once again, I'm sure you were asked it a lot, and I'm going to be inflammatory and ask it today. But in terms of harm, vaping and smoking tobacco are often, there's a lot of conversation around the fact that vaping is less harmful than smoking. I wonder if you have any comments to kind of wrap up the session on that, and then perhaps any future direction given the Public Health Act that was just released, and contextualizing future research with that as well.
Did you want me to answer that one? Or
Yes, please.
Okay.
I think Cora might have that answer.
I think one of the things that's happened over the last few years with the rise in use of vapes, and particularly the concerns about young people taking up vaping, is that it has actually, there's been a lot of effort put into raising awareness that there may be some health risks associated with vaping. And that particularly for young people that, where they are going to be, they're not already, we're talking about young people who aren't smoking, that they're not already exposed to nicotine or other substances. So for them to be taking up vaping is just a health risk for them. There's no health benefit. So I think there's been a lot of focus on trying to raise that awareness and discourage young people from taking up vaping. But unfortunately, it's taken some of the focus off the terrible harms that are associated with smoking, that, very established harms. And so there does seem to be some misunderstanding now of because people are now thinking more about vaping, that maybe the harms of smoking are starting to seem less. And I hear anecdotally and just talking to people, people switching from vaping to smoking as a vaping cessation tool, and that's just a terrible outcome. Obviously, we need people to be moving down that risk continuum down to not using anything. But if they're going to look for something to stop vaping with, it should be something like a nicotine replacement therapy or something like that we have good evidence on safety for. So I think there does need to be maybe a bit of a reset and a bit of like, you know, refocus on, hey, you know, smoking is a big problem. We have a lot of people still smoking, and this is a major health issue.
Absolutely. And I think that underscores the importance of consistent messaging and policy related to that as well. Because I think that maybe has led to some confusion on, you know, if one product's banned and one's not, why is that? And I think it's a very good place to kind of wrap up is we need to refocus on the harms of both, rather than comparing them. Ara, do you have any final words you'd like to give, on your research or smoking in general before we wrap up?
Yeah. So
You don't have to.
because my research has been focused on the impact of tobacco taxation, and I know there are lots of arguments around the tobacco tax increase and illicit tobacco trade, but I still believe that the tobacco tax increase still helping people to quit rather than making them into the financial stress or financial hardship. So but I do want to emphasize that we really need to more support for this population. So in line with tobacco tax increases. So hopefully, again, the new announced policy that just 2 days ago, or more investment combating illicit tobacco just announced by government last month will be helpful to reducing smoking rates in Australia.
Fantastic. So thank you so much again to both Ara and Coral for joining us today. If I did miss some of the questions, but I've been asking them a lot for the last half an hour, so I think we'll give them a break. But if you do want to get into contact, please email our communications team and we can direct any communication or questions towards Ara and Coral that is not able to be answered today. Just looking forward to the future, looking at the 10th of April, we'll be joined by Professor Ghislaine Allen and Associate Professor Jackie Cameron, who will be talking about the co-creation of harm reduction resources with young people who use nitrous oxide. And also just a reminder that the 9th of May is the next deadline for postgraduate scholarships, and that is fast approaching. So please visit our website to learn more about the NDARC experience as a postgrad, the support that we offer, and also you can find more information with that scan there that will be on screen for a little bit. Thank you again for joining us, and we'll see you soon, hopefully.